A very good morning to one and all. Today we have with us Geert Basin speaking to us from Andalusia in Spain. He brings rich experience in healthcare from the insurance sector, both at the European Union, in Belgium, and also in Spain. Thank you very much for taking time out, Geert, to talk to us today.
No problem. Thank you for calling me.
So I would like to begin with the first question. It's been several months since the pandemic. What is the usual feeling and the atmosphere back there in Europe, especially in Belgium and Spain? Maybe through your observations, if you could walk us through that.
Yeah, I think at the moment when I left Belgium a couple of weeks ago, I think the Belgians were a little fed up with all the measurements taken. That means that it was kind of the new issues were gone, and it was kind of let us visit our family, let us visit because they were in lockdown, let us visit our friends, let us go on with life like as it was before. Yeah? Also, Belgium is at this moment is coping with putting up some new measurements because it's not so easy to put up new measurements at first. And when I came to Spain, there was a slight difference because here in Spain they had a more severe attack of the COVID. It was one of the two most affected countries in Europe, together with Italy, where it all started in Europe, and Spain. Both of them were very stricken by the COVID pandemic. So now, at this moment, I think Spain is more apt to living in this COVID scenario. Let's say, it's kind of scenario because here, distance is kept more. There are also more fines on not having, for example, a face cap. There are more controls by the police, and even here because I'm here in a Blason vacation holiday center, a holiday city. On the beaches, there are also people who are mandated to check up if everyone is keeping up with the procedures. So there's a difference. I think there's a kind of the more you go to the north, the more people are fed up with all these measurements, and it's a kind of slowing down on that issue.
Great. Do you feel the health systems are starting to cope with the pandemic right now, and life has started to resume back to normal? What is the general feeling around health systems right now?
I think at the moment, both Spain and Belgium, and also other countries in Europe, some did struggle to cope with the highest peaks in the pandemic, but most of them got well, took good measurements. Most of them could cope with the problem. For example, Belgium, which I knew, one I know best, Belgium was coping rather good because we never used all the available high intensive care beds. So we had, even in the highest peak of the pandemic in Belgium, we still had beds in intensive care for free. Yeah. I also heard from some hospitals where complete wards were foreseen to take patients with COVID. They were put in place, but they didn't need to be used. So we had some spare wards.
Okay.
So I think when the second wave is coming, I think we will be able also to cope with it. We are expecting at the moment the second wave. In France, in some regions, and also in Italy, here in Spain too, it was a little more difficult for the health system, for the offer of healthcare to cope with the problem. So because that's most of the time certainly in Italy and Spain, it was because of the amount of patients was that high that it was very hard to cope with it. Also in France, in some regions where the density of hospital beds is not that high, it was a problem. But most of the European countries did not really had a problem at this moment. Yeah. The only problem that is coming up now is how to, and that's mainly also in Belgium, how will we finance the whole situation? Because a lot of most of the hospitals had to stop regular treatments. Yeah. So acute had to be postponed. So the income on that level went away, and COVID financing needed to be put in place. So and that's something that will be an issue for the next month. But it won't be an issue only for the hospitals. It will be an issue for the whole of the economy, I guess.
What lessons do you think can India learn from the mistakes made in Europe at large, or probably because of the overconfidence or ignorance? What do you think can low and middle income countries like ours learn from?
What struck me the most, because I rather think of me as a European than as a Belgian. Yeah. What struck me most is the fact that at the peak of the crisis, all nations were acting on their own. So even we have a Europe of 27 states, all nations were taking their own measurements. Yeah. So nobody was talking to another because everyone was falling back, crawling back into his own nation, and even at a certain moment, Schengen or no Schengen, borders got closed. I think that's for Europe a lost chance, a lost possibility to cope with such a major problem and not to look at it based on country borders, but on regions. Because a lot of regions, cross-border regions, are really collaborating together, are really working together, yeah, and are really depending from each other on healthcare, but also economically. And I think it's a kind of missed opportunity for Europe to look at Europe in another way, to look at kind of how are we coping with the regions and not coping with countries. Yeah. Yeah, and that's kind of the discussion that's going on. That's a lesson learned for Europe, I guess. For the future, we should think about coping with these major problems, not only on national levels, but more on a European level. Knowing India a little bit, India is even more vaster than Europe. Yeah. So India, I've been comparing India on healthcare in many occasions before, for example, on putting up healthcare systems and things like that. I think as India is a vast country with a lot of differences in the very states. I think this in India, it could also be taken care of the situation, not only thinking about the states, because a lot of health issues are state issues in India, but taking care of it on a higher level, on an Indian level, and not only looking at the states, but looking at the regions, because also borders in India, state borders are not really the borders of the people. And I think regional borders and regional communities are more important than the state borders in this case, because that virus or an issue like as this issue is not taking care of borders. It's not looking at borders. It's looking at communities, because it's attacking. In fact, it's attacking community. That is COVID does. So I think in the future, and not only in India, not only in Europe, but in the future, we should more look at community, something what's already happening now in Belgium, in Europe, yeah? Because some regions here in Spain at this moment are in a lockdown.
Okay.
Because there are some breakouts coming up. Yeah.
Do you think that the lockdown really works? Because for us in India, the lockdown has been a massive failure, and anyone with basic elementary common sense would tell you that. Because during the lockdown, we had very few cases, and now we are skyrocketing. So, do you think lockdown as a model has been working for Europe?
We have the impression that lockdown has been working. Yeah. Because the whole of Europe has been in lockdown from March until June, July, almost. Yeah. And we could bend the curve down. We could get it down. We could get it to an acceptable level, let's say. On the other hand, I think the lockdown should be accompanied with some severe measurements as really punishments, fines, and things like that. Because at this moment, for example, here in Spain, if you don't wear a mask on the street, yeah, you can be fined. Yeah. At this moment in Belgium, I hear from people over there that they want to introduce the masks, even on the streets. Now in shops, it's you have to wear a mask, but on the street, it's not necessary yet. Yeah.
Okay.
They say you should do it, but we can't force you to do it. I think they should force it because it's a protection, not a protection for yourself, but a protection for the others. But as long as you can't put a fine on it, I think it's very hard to get to people and to get people to do it, because that doesn't work. A lockdown in the way we had it, for example, in Belgium, has worked and has also shown us a lot of other the opportunities that were apart from COVID. Yeah. So I think in Belgium, and I think also in Europe, COVID has shown us that we can organize things in another way. Yeah. And I think that in the long run, we will need to go back to new lockdowns. But as I said just a few minutes ago, the lockdowns we're going to face now will be regional lockdowns. Yeah. Will be even local lockdowns. For example, here in Spain, there are two villages in lockdown, and the one big city is close to lockdown. For example, at this moment, Barcelona, one of the major cities, the second biggest city in Spain, is on the eve of lockdown, I guess. And I think that will be the future, because economically it will be difficult to put up a national lockdown or European lockdown for all countries, because it's such a burden already, the past lockdown, that it will be very difficult to motivate enterprises and people to go to another lockdown. So it will be very regional. What has also happened in Germany, for example, when there was a breakout in a meat car.
Of course.
So that, I think it will be more local now, but there will be other lockdowns, because we have the impression that it can work. I think the problem with lockdowns in India is that the possibility to reach people is some lesser than to reach all people is a little lesser than it's possible in Europe, because the communication means are not so dense in India as they are in Europe, for example, and it's much harder to motivate people to go to lockdown than to Europe. And I also don't think that it's for example, in the rural areas, yeah, in India. I don't know if it's really necessary to put up lockdowns because the contacts and the possible contacts with COVID are lesser than, for example, in the cities. When I look at Bangalore, I think for the cities, lockdown is a perfect system. But in the rural areas, first of all, communication is very difficult over there. And motivation will be low because it's far away. That COVID.
So,
In cities, it could work better. Could work better. Yeah.
Tell me about your perception, given your rich experience in risk management, working across diverse segments in the insurance sector. Uh, where do you see the insurance industry being headed, especially in terms of health insurance?
Yeah. I think I'm involved most closely to the Belgian situation, of course, in this case. And as you know, Belgium has a very wide health insurance, state health insurance, and for us it was already a burden to work out new ways of financing because the way COVID patients were treated was a completely new way of treatment. Yeah. And that way of treatment was not really foreseen in our reimbursement system. Yeah.
Okay.
And so we had to look at complete new reimbursement modalities. Yeah. On the other hand, I think in more private situations, this will be a burden to find ways to finance it because I think it will be affecting the premiums of health insurance, private health insurances at this moment because it was the treatment of these patients was a very time and money consuming issue because a lot of patients got in intensive care and got in intensive care for a long duration. And there were a lot of investments to make, not only for health insurance, but also for the care providers, because the aid for respiration devices, the respiration devices were very, very hard to find at a certain moment, and even it was very hard to find protection gear, such as face masks and things like that. So these things were sold at terrible prices, high prices. So I think it will be a burden in the future to cope with that problem, and a lot of private health insurances will be facing kind of losses this year. Yeah. So it will be affecting the premiums, I guess. And I think it will be very important to have as much as possible, as fast as possible, excuse me, a vaccine for this COVID problem. We both read some promising articles from what's happening in Oxford.
Of course.
Yeah. On the other hand, we also see in Belgium that, for example, in Ghent, they're starting some tests also. So they are they're starting with human tests on a vaccine. So I think everybody is very hard looking for a solution for the problem. And I hope that for the end of the year we can start the vaccination program all over the world.
That's a hope we share, and
Yep.
hopefully pretty soon we have something where life comes back to normal.
Yep.
And I also get to meet you again.
Yeah. Why not? As soon as possible, I guess. Yeah.
A lot of companies these days are reorienting workspaces with encouraging work from home.
Yeah.
I've been a proponent that work from home is not a long term recovery solution. It cuts social engagement, kills diversity, paralyzes travel. What's your viewpoint on this, and how is Europe dealing with it?
Yeah, on this subject, last week I had a talk with, you also know Dr. Sudip Shetty, who's working in Nita University, amongst other places, and we were talking about it too. What has changed in working situations now with the COVID crisis? So I think for Belgium and for Europe, we started working from home much more than we did before. Yeah. Working from home was kind of a privilege you had at a certain moment for staff members and things like that, people like that. But it seems that now we found a way even to get people in the administration, yeah, to work at home. And I think in for our organization, yeah, at a certain moment, more than 50 to 60% of our people were working at home. Because as a health insurer, we could not close because we had to be there for our clients. So we did not close, but we put, to avoid contacts, we put up to 60% of our people working at home. But that made us think about the future, because when you can keep up your company with 50% of your people working from home, that means that 50% of your workspaces get vacant. That means that your energy cost goes down. Yeah. That gives you a kind of your opportunities. And Professor Sudip told me from, yeah, but won't it be, then won't the next step be that people won't be paid lesser because they don't have to go to work to come to work. They can work from home. They have lesser costs and so on. But even at this moment, we think we should pay them a little bit more, yeah, when they work at home, because they use their own electricity. They use their own internet connection. Yeah. So we can provide them some money for that. So I think in the future maybe it will, and even I think in Europe the presence in the workplace is less important than the results. It's not only in Europe, but that's everywhere. But the conscience that that issue is really there is higher at this moment, I guess, in Europe than anywhere else, because you don't have to see your collaborators. You have to see the results they provoke. Yeah. There will always be a certain need of coming together, and not everything will be solved by video conferencing and team meetings and whatever is possible, because that's an issue at the moment we are coping with, because the team meetings we had were sometimes more tiring than the face-to-face meetings you have in a normal situation, because you are constantly working in meetings. But I think at a certain moment, an in between working at home and working in an office will be, we call it a kind of a new normal. Because also for the environment it's better, because traffic will be less dense. Yeah. People will be able to work at home. All technical means are there, certainly in administration. Uh, someone is working in a garage work with a car who has to work on cars can take the cars home. Yeah? But in an administration, I think it will be one of the future things. On the other hand, we also cope with some problems in working at for people who are working at home, because social isolation is one of the issues we are confronted with already after 3 months of work of people who have worked 3 months of working at home for some people. So financial isolation is a problem. Also, people with children. It's not so easy for people to work in a living room where children are playing. That is also an issue because our houses and most of the houses are not really apt to working at home. So we should think about that. Yeah. So there are some challenges, but there are certainly some advantages to.
Last question, Geert. Since you've been a seasoned visitor to India and have traveled very widely, what are the things you would possibly recommend that we adopt or change in the way health systems approach both urban and rural realities? Your final thoughts.
Final thoughts. I did put up three things. Yeah. I think it's very, and that's something I said also. I discussed with the former Karnataka Minister of Health, and we did disagree on that issue. As you know, I think there should be work towards a unified health care system. Yeah. With the focus on primary care. Because as I know India a little, and I made several years ago a kind of little study about what's available on health care and health insurance in India. Most of the health insurances cover secondary care. Yeah. And I think it's very important to focus in the future on primary care because it's the less expensive care, first of all, and it's the care most people need. Yeah. That should be one of the most important, that is one of the most important future issues for India. Not only for India, I think it's one of the most important things for all countries who are in development on healthcare. So working towards in solidarity, health provision in primary care is one of the most important things. And also for CHD, I think it could be a very important thing to not only work on crisis management and damage control, but also to provide a primary healthcare system with a mix of kind of clients, members, a mix of people who can afford it and people who cannot afford it, so there can be some solidarity. What I also wrote down is I'm looking. What's also important is to start from the system that is already existing. Yeah. Because I think getting older, I believe more and more in evolution than in revolution. Yeah. I used to be a revolutionary thinker, but I think evolution is getting, I think, more and more important because if you can change it. Yeah. Uh, I you made a journal. Systems are much more changeable from within than without. Uh, so I think the Indian models that exist at this moment should be enlarged. Yeah. And we should think about it first of all. And we should, without any offense to what is existing, but I think the organization as CHD would have the possibility to show what is possible. For example, primary care. Yeah. To really, because in, for example,
I can't hear you, Gate. Could you come again, please?
uh, is this better?
Yes, it's better now.
When I, for example, when I look in how it's grown in Europe, yeah, it's really an evolution. It has been an evolution from local initiatives to a national health system. Yeah.
Of course.
And I think that could be also one of the main things in India. In that manner, I've been talking to people in Mumbai, in Bangalore. But the problem at this moment, I think, and that's one of the major problems also in India, it's not very spectacular. Because top surgery, yeah, reimbursement of top surgery and secondary care is very fancy. Yeah, it's you can show off with it. Yeah.
So
Primary care is less. It's less. But
that's an area CHD is trying to bridge the gaps, working with government health systems and also with UN partners and corporates.
yeah,
Because I mean, we believe that primary care synced with universal health coverage is the future and the present of a modern day achievable healthcare world.
yeah, I think it is, and one of the goals should be to be as less dependent from charity and
So,
donations, and make people patients, clients, possible patients, take the matter in their own hands and with some support of professionals, put up the system from down up.
yeah, I
Uh,
think that is the way forward with what you're suggesting.
yeah,
I mean, it might take a while, but I'm confident we should get there.
yeah. Don't overrush it, yeah, because, for example, in Belgium, as it is now, as an embryo started in 1903. So we're almost 120 years later now, and yeah, we are now coping with a system that is good, but that needs some improvement and needs some modernization, I guess.
Sure. Geert, thank you very much for your time. I truly appreciate sharing your wisdom and judgment for all our viewers to benefit from.
No problem. Pleased to do this, and I hope to see you soon after all these strange COVID times.
In a corona-free world.
Corona-free in a corona less dense, less dense corona world.
Sure. Thank you.
With effective.
Bye, Geert. Take care.
Bye. See you. Thank you.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.